Hello everyone, I'm Akhona Mbangi, clinical nurse mentor working for Beyond Zero Bumb'INGOMSO Health Intervention. But for the month, I'm gonna be your Agony Auntie. Okay, our first question for the day is, what is Bumb'INGOMSO Happy Hour? Why was it made? Where is it? And who does it? Okay, Bumb'INGOMSO Happy Hour is an hour that is dedicated to young people. Before it was even done, young people had concerns that when they go to facilities, they are taken care of by old nurses, they queue for long hours, and they don't feel comfortable in facilities. So Bumb'INGOMSO decided to introduce a happy hour. Much as we are saying it's a happy hour, actually it's 2 hours in all facilities in BCM, whereby there's a trained champion nurse taking care of young people, giving them information that is relevant to young people, health education with topics relevant to young people, and also treating them for whatever conditions they come to clinic for. During the happy hour, young people, they meet as groups, they discuss challenges affecting them, like I said earlier, as well as the nurse will also come and introduce or address the topics that are raised by young people. And again, in this happy hour, we encourage young people to be pioneers. We know that it's much easier for young people to understand other things or other topics when they are discussed by their peers. So we encourage them as young people to engage together and talk about the issues affecting them. Our next question is, what would you say are some of the challenges still faced by young women in receiving healthcare? Well, one of the challenges that are faced by young people is the issue of long queues. If you go to our facilities, you find out that our facilities are serving large population communities as needs, meaning that abantu will have to queue as alliances in. However, with the implementation of a happy hour in other facilities, kuba ngcono. But with the issue, with the pandemic issue, it has become a strain to health facilities because clients were allocated for different streams, but with the pandemic it has become an issue, so people are still facing the issue of long queues. Again, staff shortages. If you go to facilities, you'll find out that bambalwa amanesi that are working in facilities. So unese one will have to care for abantu abaninzi. Again, we also have transportation barriers, especially for abantu abahlala ezilalini. You find out when a clinic is far away from where a person is staying, then a person has to travel to the facility. Ufuneka bhatale ukuba aye kufacility, so some will not go to a clinic because umuntu akanamali yobhatala i-transport to get to a clinic. So yenye challenges. And again, the issue that clinics are far away. Clinics make suppose baze within 5 kilometers up abantu bahlala khona, this population they are servicing not beyond 5 kilometers, so that it's going to be easily accessible to everyone. The next question is, what more can be done to improve young women's access to healthcare services? During the pandemic, most young people were unable to access health services. So I personally think that we should introduce new means of making young people to access the services. For example, we should have mobile clinics that are going to the communities where young people are to give them services. When we're talking of young people, young women services, we're talking of services like your SRH, which is your sexual and reproductive health services, whereby young people will be given family planning in the comfort of their communities, at the comfort of their homes. Again, door-to-door treatment delivery should be done for young people so that they do not default treatment. If a young person is on treatment, it should be delivered door-to-door, because during the pandemic time, young people were unable to go to clinic. As we all know that during the pandemic, everything was done differently. So again, we should conduct more community awarenesses and more community outreach. We know where young people are. We should go to the hotspots where we know we'll get young people and give them the services that are relevant to them. Again, I believe that pharmacies should provide free family planning services. If a young person goes to the pharmacy for family planning, for contraceptives, they should be given to them freely. They do not have to pay for those services. With young people, we know young people are glued to their phones. Technology is the issue with young people. So I believe we should develop apps that will allow young people to access services over their phones. For pregnant women, there's an app that is done for them. It's giving them information. I believe we should also have that app for young people, whereby we're going to be saying, Akhona, it's your family, you're supposed to get your contraceptives today, or we give them reminders a week before their appointment dates, so that a person gets ready to go to the clinic, or a person gets ready to be given the service. Healthcare services is one of the human rights guaranteed by the Constitution. Young women and girls are regarded as one of the key population and naive group. So it's very important to banabas access health services. Mostly when we talk of e-services, for young people, we're focusing on your sexual and reproductive health services, condom distribution, family planning, STI education and treatment. Also, it's important to remember that we should focus more on prevention, because we believe that prevention is better than cure, as well as early diagnosis. Hence, we want young people to access health services. Thank you.